Now, good afternoon, Miss Barami.
Good afternoon, my lord. Our next witness.
Now, Mrs. Jelley, I understand the problem has been sorted. Again, my apologies for that. Miss Barami, please continue.
Thank you, my lord. I apologise again for that breach. I'll start my question again. So you've provided a statement to the inquiry about your daughter's experience of developing long COVID and the healthcare she received both through the NHS and private sector. Is that correct?
That's correct.
Thank you. I understand your daughter was 13 when she contracted COVID in April 2020. Please would you tell us briefly about her lifestyle prior to contracting COVID and subsequently developing long COVID?
She was super healthy, very fit, did a number of sports, quite a few competitively. She particularly enjoyed skiing. Only a couple of months before contracting COVID, she'd been away at a school competition competing skiing and won medals. She was very academic. She worked really hard at school. She loved school. She was an academic scholar. She absolutely thrived on life, had a great social life, was popular, happy, had the world in front of her, was ambitious. And then, well, after contracting long COVID, it all fell away. She couldn't attend school, she couldn't study, she definitely couldn't do any sports, she could barely walk around the house. She was just extremely unwell.
Yes. Could you tell us how her symptoms developed and progressed in April 2020?
Yeah, initially she had COVID and sort of got over it, sort of the way everyone seemed to at the time of the young people. It was a few days of feeling very unwell and then was feeling better. She then had a few days, I said to her, back to school, and it was online school, and she was sort of sat at the computer, and it was literally sort of maybe 10 days after initially contracting COVID and maybe 4 or 5 days after sort of improving, and I went into the room and she was slumped asleep at her desk, which was really strange and very unusual for her. She continued in that vein. She was really tired. She couldn't study at all. She was just in bed for sort of 20 hours a day. She was sleeping all of the time. I was having to wake her to have drinks to feed her. But we just thought that it was just post-viral and she'd improved. We contacted the GP. He was of the same opinion. And things just kind of didn't really get better for quite a long time. All her blood results were normal at the time, and they just said, well, things will get better. And we had no reason at that point to doubt it because it was all so new.
Thank you. And how was her schooling affected?
She wasn't really able to do anything at all. She certainly didn't complete that term. She did try to go back in the September, but she was desperate to see her friends to get back to education, and she just wasn't able to. She lasted a few weeks, and it really made her very, very ill again, because she'd made some slight improvement at that point, but then it all went back again. She was just too ill to even go to school at all, and she actually said, I can't do this, I can't be in school anymore, Mum, which was heartbreaking because she really, really missed it.
And she had been in boarding school before, so she had been able to stay away from home, but she wasn't able to anymore.
Well, she went into school, but we thought that actually being in boarding school would be beneficial because she'd be able to go to bed during the day.
Yes.
Whereas normally children wouldn't be able to have that kind of facility of having a bed on site. So the idea, and the school agreed that she could just go back to bed if she needed to. She wasn't to do PE, although they did actually make her go to the school field, change into her PE kit, which she found exhausting. But she just wasn't able to keep up. She was doing a limited amount of lessons. She was getting migraines by this point regularly. She was suffering a lot from back pain and muscle pains, but hadn't vocalised it to anybody because her overriding condition at the time was that she was just so tired that she almost just didn't complain about all of the other things that actually were bothering her as well, like the breathlessness and things that actually she just sort of encompassed into, I'm just so tired that I can't do things, so didn't really complain about the other things that came out later that she'd actually been suffering from for quite a while.
Yes, thank you. And in January 2021, she contracted COVID again. Would you like to tell us about that and the effect that a second incidence of COVID had on her?
Yeah, she'd made a slight improvement by the January, and then it was back into lockdown again. And so she was going to try and do a bit of online school if she could. But then she contracted COVID again, and she was just back to square one. In fact, literally where she was sleeping all of the time. She was just feeling really dreadfully ill. It absolutely took her back to that point. And things weren't improving. So by the March, she really hadn't made any progress at all. And that was the point where we asked to see a paediatrician and asked the GP to refer her.
Yeah. And you mentioned in your statement you'd also bought a Fitbit to try to track her heart rate, and you found her to be tachycardic, and you then made an attempt to be referred to a paediatrician. Would you like to tell us about that, how that process went?
To be fair, to the local trust, we saw the paediatrician really quickly. I think it was within a couple of weeks, which was incredible. However, when we did see him, and I said, explained how I thought it was long COVID, and he said he didn't know anything about long COVID. So actually, although we got to see a doctor, it didn't help us. He did try to be helpful and tried to kind of look at things, the normal things, like he looked at our blood tests, but of course, most people's blood tests come back normal or don't show any significant irregularities. So he kind of looked and said that everything's fine. The tachycardia, when she's sitting, her pulse was fine, so that looked fine as well, because that's how they tested it. Her oxygen levels looked fine because they were variable depending on her activity. Yes. And there was no assessment of that. I appreciate, in retrospect, that they didn't know much at that point about these kind of things, but I was concerned that, I knew things weren't right, but they weren't seeing her when they weren't right, or believing that things weren't right when I said, no, actually, here's her results, here's her pulse, and that wasn't acknowledged. Yes. So, and anything we needed from the paediatrician, I was having to ask for myself. So, things like migraine tablets, I'd have to say, can you prescribe? And he'd say, oh, I'll look into it and I'll get back to you. And to be fair, he did. Yeah. But I shouldn't have had to be her doctor. And there's many parents that couldn't look at this information. I was a nurse by background, so I had some idea, but I'm still not a doctor myself, and I never claimed to be. But I was having to do everything. I should have just been able to be mum, and the doctor should have said, okay, let's look at what we can do, and they didn't do that. Yes,
thank you. And in paragraph 14, you mentioned that the consultant paediatrician continued to see your daughter about once a month. For how long did those monthly visits continue?
I think probably about 6 months, and but he was accessible whenever we needed him, and I really will give them credit for that. Yes. But the help that we got was literally just things that we asked for. There was no initiation from the doctor, the paediatrician rather, to suggest things or to say, I've read some research that suggests this might help. Yeah. I would say, she's not sleeping, can you prescribe melatonin? She's got migraines, can you prescribe pizotofen? Can you? And he would then go away and say, well, yes, that's suitable for someone her age who suffers with this condition. But he wasn't looking at it as long COVID. Yes. And he wasn't putting any of the pieces together. And he wasn't saying, he just wasn't looking forward at what she had and suggesting things himself.
Was that impacting your mental health, having to play that role? Yeah. And feel like you weren't being heard, perhaps?
It was not being heard, but it was also incredibly stressful having to be the one who was trying to be this doctor to her, trying to be the one to read the research, which I'm severely visually impaired. It's really hard to read the research. It wasn't pre losing my eyesight in pre-2020. I actually got my master's in public health. I was well equipped to read the research, but not with my eyesight. And again, still not a doctor. It should have been doctors looking at this and trying to find out how they could treat these patients, these children. And they just weren't. And I don't think still are to some degree.
Thank you. Then You were subsequently told by a private dietitian that he thought your daughter may have mast cell activation syndrome, or MCAS for short,
Yes.
and he referred you to an allergy specialist in England who subsequently made recommendations to your daughter's GP.
Yeah.
Can you tell us what the GP did about those recommendations?
He was very sceptical. He said that private doctors will tell you whatever you want to believe because you're paying the money, and he wouldn't even look at it. He wouldn't even look at the research around it to say, okay, well, let's do our own tests. Let's send her to our own specialist. Mm-hmm. It was instantly just dismissed.
Dismissed.
And didn't even make a referral himself to say, okay, well, let's refer her within our own trust and let's see what they say.
Yes.
It was just instantly shut down and dismissed, and I was mocked basically for even considering listening to a doctor outside of the NHS.
And to you, did that seem to be solely based on the doctor being outside the NHS, as opposed to any comment on why a recommendation or a diagnosis was incorrect medically?
He was absolutely clear that it was out because the doctor was outside of the NHS, even though at that time the private doctor we went to was actually the lead allergy consultant at a major teaching hospital in England. Mm-hmm. He still dismissed it, because even when I pointed that out, he said, yes, but when he's working privately, he'll just tell you what you want to hear. Yeah. Which, I didn't want to hear that.
Yes. Thank you. So the GP and the consultant paediatrician, you say, didn't accept that your daughter had MCAS, but they did make a referral to the Chronic Fatigue Syndrome Clinic, yes, as recommended by the specialist, and also to the Child and Adult Mental Health Service and occupational therapy. I think the clinic, the Chronic Fatigue Syndrome Clinic, was in Glasgow. Did the clinic accept the referral?
Yes, the clinic in Glasgow accepted the referral and said they were just waiting for the approval for funding. Mm-hmm. When it was refused, I spoke to the consultant, a paediatrician, and he said that he'd been told that it was purely based on the fact that it would open the floodgates to other long COVID sufferers, that she'd been refused. Because that actually wasn't a paediatric clinic, but because she was, I think, 15 at that point, and 16 was usually their cut-off, they still said she's old enough that we will accept her. Mm-hmm.
So there was a service that could have helped her,
yes,
but because of resourcing issues and fears, yes, of demand, she was denied, yes, service under that, yes, clinic.
And not offered any alternatives. So she was refused occupational therapy. Occupational therapy didn't even assess her, even though she was referred on at least 2 occasions by the paediatrician, because he repeated his referral. And the same with CAMS. She was referred at least 3 times and never even assessed or seen by the service to refuse her. They literally refused it based on literally nothing, because if a paediatrician has said, I think she needs a service, yes, then I think she should have at least been assessed, but they refused.
Did they give you any reason for the refusal?
No, the paediatrician said that it was basically that she wasn't suicidal, was her reason for being refused CAMS. Mm-hmm. But regarding occupational therapy, they didn't give us a reason. And when our physiotherapists within the NHS requested aids for her through occupational therapy that she recognised that she could need, occupational therapy still refused the aids. So there was some acknowledgement that she needed aids, but then occupational therapy wouldn't even assess her or provide her through physiotherapy.
Thank you. And then at that point, you had to arrange private counselling for her, is that correct?
That's correct.
And how did that go?
The counselling was really beneficial. Although I think, quite sadly, I think a lot of the benefit she got from it was the fact that she got to speak to somebody that wasn't me, because all her conversations entirely were with me. She didn't get to talk to anyone because she didn't go to school. She didn't have any contact with the outside world because she was housebound. And it's no wonder, actually, that she became more and more depressed, because she had a chronic illness that she saw no sight or relief from in finishing. And that must be incredibly difficult at any age, let alone as a child.
Yes.
And things were getting worse, and she was becoming depressed. And eventually, we did, I think I say later on in the statement, we did eventually seek help for her depression, and the GP felt that they were unable to help because she was under 18. And CAMHS wouldn't help because they refused to assess her. And the GP even said, if she was over 18, I would give her antidepressants, but because she's not, I'm not qualified to give her those. So we ended up having to pay for a private psychiatrist who said her depression was caused by suffering from a chronic illness and her life as it was, and not, she was depressed because she was chronically ill, not chronically ill because she was depressed.
Yes. And how were her symptoms continuing at that point? What form were they taking?
Oh gosh, at that point, where were we up to at that point?
I think we're at paragraph 18.
18, yeah. So we're looking at sort of May 2021. She was, she was still suffering very badly. She was still having sort of sleeping a lot of the time. Her sleep was very disrupted, so she might not sleep until 3 a.m, but then she'd be awake, and you can't kind of write the system, her body system. There's a lot of suggestions around sleep hygiene and that kind of things, but it's not as simple as that with the, long COVID or any of these kind of like chronic fatigue syndromes. So she was just really struggling. Her muscles would be painful. She would get severe leg pains, back pains, pains in her shoulders, her neck, migraines frequently, although we were starting to get on top of that with the medications that I'd asked for her to be prescribed. It was just really difficult. And then obviously there's just so many. So tachycardia. So if she was walking around the house, her heart rate would really, really shoot up, and she'd feel these kind of palpitations. She would feel dreadfully breathless. She'd get to the top of the stairs, and she'd be so breathless so that she'd forget why she went upstairs, because her brain fog would really descend because her oxygen levels were so low, which we didn't really realise how bad that was until sort of time went on and we started to measure the oxygen levels more.
Yes, and that was continuing to affect her academic abilities as well at that point.
Yeah. She was trying desperately to study, but she couldn't remember things. I think the best example is she'd studied French since she was probably about 5 or 6 years old when she first started school. But she couldn't, and she was in the top sets at school. She'd been in the top sets. She was doing really, really well with it, and by this point she couldn't count to 10 in French. Because she couldn't remember it. And that was where her memory would be. She would have a class with her English teacher online, and he said to me one day, it's like meeting her for the first time every day. So the next day it would be like meeting her for the first time, because they'd have to start from scratch all over again. And that was just how her memory was. She couldn't play strategic board games. She couldn't play. She was really easy to be beating cards because she had no kind of strategy or mental ability for it.
Yes.
And even then, she only had the energy for a game of sort of simple rummy, maybe once every 2-3 weeks, and she'd enjoy it and she'd play it for 10-15 minutes, and then she'd say, I'm too tired.
Thank you. And in October 2021, you took her abroad for medical diagnosis and treatment for the first time because of long waiting times in the UK. Is that correct?
That was for the dermatologist?
Yes.
Yes, yeah. She'd developed, she'd been losing her hair as well as part of the long COVID. But then we realised that she had these really pussy, horrible wounds in her head as well. and the waiting times were so long that
Yes.
we took my husband works overseas, so had insurance. We're one of the lucky ones, and I really acknowledge that we're totally one of the lucky ones in this. And so we accessed private healthcare in Saudi Arabia and had that treated.
Yes. And do you know whether, I wonder whether any doctor mentioned to you, was the waiting time a consequence of the pandemic restrictions, or was that the standard waiting time even pre-COVID?
No, no one actually
No.
said whether
Okay.
it was because of COVID in general or if it was, yeah.
Thank you. Then in December 2021, you wanted the GP and paediatrician to investigate the possibility of your daughter having postural orthostatic tachycardia syndrome, but they refused. You
Yeah.
say, on what basis did they refuse to investigate?
They were dismissive of it as a condition. They were dismissive generally that it could be something that she had, and they said to us that the wait for, you can get a cardiology referral, but it's going to be at least 2 years. And that was it. But then didn't do a referral. They just said, oh, well, it'll be at least 2 years, as if, well...
So they didn't
so
even put her on the waiting list?
We won't do anything because the wait's too long.
Thank you. You state at paragraph 27 that your daughter now uses a wheelchair as a consequence of long COVID. Has she received support to adapt to being a wheelchair user?
Absolutely not. We were initially refused by physiotherapy a wheelchair. The view was that she wouldn't try and walk if she had a wheelchair, which is ludicrous because what child wants to be pushed around by their mum and not be able to go anywhere on their own? Yes. But having the wheelchair actually meant that sometimes she could leave the house, sometimes she could go to the shops with me, and we could get a taxi to the village and I could push her around a couple of shops and she could see people. And that wasn't even very often. But without the wheelchair, she would be stuck at home. She couldn't walk enough to do that. So she wouldn't be able to leave the house. And their view was, well, that will encourage her to walk, when actually it's not a case of not wanting to walk. It's a case of not being able to.
And they didn't offer any other device, such as a walker that would allow her to walk and be mobile?
She was given nothing to assist her in the home at all at that point. We bought the wheelchair ourselves and had to just assume we knew what we were doing. And it made a massive difference. We bought a stool for the shower because she wasn't able to have showers even sometimes, and it just enabled her to have showers a little bit more often because she could sit under the shower. She wasn't able to go in the bath because the temperature affects the pots and makes them feel worse. She was just really struggling, and there was nothing to help her mobilise or to help her around the home whatsoever.
And did the physiotherapist or occupational therapist, either then or since then, make any attempts to help rehabilitate her, to help her regain the ability to walk?
She did see a physiotherapist from the local hospital for a while. She was great in some ways because she did let her do it by Zoom a lot of the time, or whatever the local trust's equivalent was. But a lot of the focus was on trying to push her forwards and trying to get her to do more, which was outside her scope of ability. And it actually crushed her a little bit because she felt like she was failing, felt like when she went back to the physio the following few weeks or months or however long it would be between the appointments, the physiotherapist would be, have you not been able to do it? Have you not done it? And she felt like a failure, and felt like it was being inferred she wasn't trying, when actually it really obviously wasn't the right thing for her. She might have been better with breathing exercise or something different that would have benefited her, but actually it wasn't geared up to long COVID or or her condition, the fact that she would be variable, the fact that she couldn't do a lot of things. And eventually she did get occupational therapy, but only because I approached the local council rather than the NHS. I found out because of my own condition with my eyesight that occupational therapy was available from the local council. Nobody told me with regards to my daughter that this service was available. It was literally only because of my own condition that I found out about this. And they were fantastic. They came out fairly quickly. They said, yes, you should definitely have a wheelchair. You've already got one, so that's great. Made sure that she had things around the house to make her safe. So a rail at on the stairs, where we have a turning on the stairs, so that because she was wobbling and nearly falling, it wasn't safe. So making the house safe for her, giving her a bed rail so she could get out of bed more easily and more independently. So, you know, a proper seat for the bath that was safe rather than the makeshift one that we'd had to buy for her that actually was better than nothing but not safe. And it was great, and it made a massive difference to her cushions, a table by her chair so that she could actually reach things and improve her posture. And it was things that made her feel actually like somebody had listened to her in the first time in a long time.
Yes, thank you. Then in March 2022, you again felt that you had to take your daughter abroad for diagnosis and treatment, as that didn't seem to be an option through the NHS.
Sorry, when are we looking at?
March 2022.
March 22, yeah. Yes, it's we were struggling because nobody was really acknowledging the long COVID. When I'd discussed it initially with the paediatrician when we first saw them in March 21, and I'd explained about the definitions of long COVID, and he kind of went, "Oh, I suppose it is," but he didn't document it. Nobody was calling it that when they referred to her. It was just sort of post-viral, and that was kind of as far as they would go. We were, again, extremely fortunate. We had
Very good. That's all been sorted out. Don't worry, these mistakes are easily made, Mrs. Jelley. On you go, Ms. Bromley.
Thank you, my lord. Miss Jelley, if you continue, please.
So we were extremely fortunate that we actually had access to a professor at Johns Hopkins in Baltimore who was a specialist in post-viral conditions and chronic fatigue in children. He's sort of worked in this area for the last 30 years. And he very kindly gave us an informal consultation and made a referral to one of his colleagues who is a cardiologist in Saudi Arabia. He'd actually worked with and written papers on POTS and post-viral conditions and chronic fatigue in children with this particular doctor over a number of years, so very well experienced. So we were able to take my daughter across to Saudi to see this particular doctor, and he diagnosed her with POTS after clinically examining her. However, it didn't actually make any difference when we got back to the UK because they still wouldn't acknowledge it.
I'm just looking at your statement, Mrs. Jelley, and I noticed that the hospital you went to in Saudi Arabia appears to have been one of these things that's happened nowadays. That it's an offshoot of Johns Hopkins. Am I correct in that?
That's correct. Yes.
Yeah, and again, when I say, "Are you telling me?" I'm not doubting what you're telling me, but is the position that the GP in Scotland declined to have regard to the view of a consultant clinician from either Johns Hopkins or a hospital associated with Johns Hopkins?
That's absolutely correct. Both hospitals are actually run by Johns Hopkins.
Johns Hopkins.
And yeah, very much so. And the GP
sounds,
just completely...
The reason I ask is it sounds extraordinary.
Yeah.
I quickly checked when you were aware, and I see that Hopkins is actually the university with most Nobel laureates in its history. Yes. Now, obviously, these gentlemen wouldn't necessarily be Nobel laureates, but nevertheless, it does give some indication of the standing of the institution, I would have thought.
No, absolutely. And the paediatrician in Baltimore actually has done work with the World Health Organization regarding long COVID in children. And yet the GP, he just said, I've never heard of him, and refused to even look at anything. Yeah, it was absolutely ludicrous. And that's when you kind of go...
But he could have looked up, he could have presumably checked. It would be easier enough to check on a chap from Johns Hopkins.
Yeah. And the paediatrician in Baltimore was quite happy to work with our GP, which was incredibly generous of him, and to offer guidance on her care, and yet he declined. The GP just wasn't interested, and the paediatrician in Scotland wasn't interested either. They were both extremely dismissive. In fact, to the point where they were actually quite mocking of the doctors the cardiologists in Saudi Arabia who'd written some seminal papers on POTS in children.
Thank you.
Thank you. Then the medication prescribed in Saudi Arabia, though, unfortunately led to eye pain, and that almost led to the loss of your daughter's sight.
Yeah.
The issue with your daughter's sight was discovered by an optician who subsequently arranged for her to attend Aberdeen Royal Infirmary as a matter of urgency, and it was deemed that stopping the medication would be enough to prevent, to stop the issue and prevent sight loss. Yeah. Is that correct?
Well, it was actually myself that said to the doctors, I think it's this, and they wouldn't believe me. The GP didn't believe me. The paediatrician didn't believe me. I then took her to the optician, who obviously then realised it was they could see on the scans that there was swelling, and it was quite severe, and they admitted her as a matter of urgency. I'd stopped the medication at this point because I thought this isn't right. But then all I've had from the GP over the last a couple of years is he keeps saying, well, that didn't do you much good. It did that medication, but it's a standard medication for POTS. It's not like he gave us some really strange medication that an unqualified doctor would give or somebody, I don't know. it was an absolute mainstream medication, and the GP has used that as his tool for berating me about care outside of the NHS.
And I presume then that the GP and the paediatrician didn't try to work with you to establish a different medication that might have been more suitable for your daughter?
I repeatedly asked, and they repeatedly refused. They just kept saying, we don't treat POTS here. I don't treat POTS. You'd have to get the GP to refer. The GP would say you'll have to get the paediatrician to refer. It was going around in circles, and eventually they kept saying, well, because I said, well, it's a cardiologist then, and it kept then coming down to, oh, it'll take a couple of years, and there's people waiting to see cardiologists who are more severely ill, and made the inference that actually POTS wasn't severe, despite the fact that when your POTS is really bad, you can barely get out of bed. It makes you feel dreadfully ill. And that was one of the pieces of the puzzle that they could have done that would have made her feel considerably better, because once she was on medication for POTS through a private doctor in the UK, it made her significantly better.
So the GP took it on himself to cast judgment on how deserving she was of a referral compared to other people.
Absolutely. He wouldn't do the referral to cardiology because he didn't think that it was worth treating. He didn't understand the condition and had and never even asked her about her symptoms. Never once in all the time we've seen the GP has he asked her about her POTS symptoms.
Were the visits with the GP online still, or were they any in person?
She hasn't seen her GP. We've lived there in this particular area for 4 years, and she has never seen the GP in person. She's had telephone consultations, and that's it.
No
we
video
can't
consultations?
Actually get in to see no, can't actually get in to see a GP.
Okay, thank you. And that has continued, and her symptoms continued into May 2022, where when she attended Aberdeen Royal Infirmary, as her oxygen saturation levels had been low at home. But after 24 hours of observation in hospital, she was discharged because her O2 levels had remained normal during that time, or above the acceptable threshold. But you say in your statement that she has intermittent episodes of low saturation.
Yeah.
Have any attempts been made to assess why she has periods of drops in her oxygen saturation?
I fought on that visit to have her referred to respiratory, who did agree to see her. The doctor was extremely dismissive. He didn't check her oxygen levels at the appointment. He didn't do any basic observations or pulse, blood pressure, anything. Didn't listen to her chest. She was, I thought, because we're under a private doctor as well, who'd suggested a VQ scan might show something and it'd be worth having. I asked for that and explained why, and he again was very dismissive. Said, if I give you this, if I let her have this test, will you be happy then? Will that be it? Can we draw a line under it? I said, well, let's see what the test says first. The test was fine, but then I contacted them again, and they said, no, we're not seeing her again. That's it now. She's had the test. I said that I'd do that test, and that would be it. And they've refused to see her. So respiratory just weren't interested at all. The letter from the respiratory doctor to my GP was literally, didn't mention anything about any clinical indications whatsoever. It didn't say anything about her colour, her oxygen levels, her breathing, how she appeared on the day. Literally no clinical observations whatsoever. It was entirely sociological, in that he thought that there was an interesting family dynamic going on, and that was it.
So he dismissed it as being
Completely
untrue
dismissed,
and something that was perhaps more behavioural or psychological than...
Yes.
real. So I take it you had told him that you had been monitoring her oxygen levels and that they intermittently fell far below the acceptable threshold.
Yeah.
Was the doctor you saw just dismissive of that?
He was extremely dismissive. He just said, well, he just kept saying, well, if I give you this test, will you know, is that it then? There's nothing I can do for you.
Yeah. Did you feel like you were being believed by the doctor?
No, absolutely not. At that point, masking in the hospital was still compulsory. I was in a respiratory department with a child with long COVID, and he
Yes.
wasn't even masking.
Okay.
That was his attitude towards COVID.
Thank you. And in June of that year, June 2022, a doctor in private practice made recommendations of certain medications and physiotherapy for your doctor, but your GP again refused to prescribe that medication. Is that correct?
That's correct.
Did he provide you with a reason for that refusal?
Because apparently private doctors will just tell you what you want to hear, and that's all the GP keeps saying to us. There's no recognition of expertise at all.
Yeah.
And the doctors that we've selected to go to have always been, we figured that if we're paying for it, we might as well get somebody who's top of their field.
Yes.
And that's what we've done. We've searched out, which is why the immunologist was in England. We searched out somebody who's top of their field.
Yes. If diagnosis had been possible on through the NHS, would you have chosen to seek private diagnosis and treatment?
No, it's desperation.
Yeah.
It's absolutely desperation.
So you had no choice but to seek private diagnosis,
Yes.
but then to try to improve and progress things for your daughter, but then your GP wouldn't
Absolutely.
work with you on that.
And it's never been about queue jumping. It's not like the services available in the NHS and we're going privately and then trying to kind of slip in sideways.
Yes.
We're being told there isn't a service or they don't know. So we try and get the information from the private experts
Yes.
in the fields to inform the GP. Like with the doctor in Baltimore, it's about trying to help the GP to understand the condition. Okay, they don't understand it. Here's the information. They can provide you with the research and the reasoning why, and we're still getting nowhere. They don't understand it, but they're not willing to understand it either in the NHS. It's never been about queue jumping or getting in ahead of anyone else. It's about trying to get some help so that perhaps then the NHS can pick up from where we've given them the information.
Yes, and use that information to help other people.
Yeah, absolutely.
And subsequently, in August 2022, your daughter started private physiotherapy sessions. Again, was physiotherapy through the NHS not something that you were being provided with?
The expert we went to, again, using the word expert, was one that a number of NHS trusts in England had turned to for help with recovery with breathing, with realigning the autonomic nervous system, which is an issue with long COVID. So it wasn't about kind of her gaining muscle strength per se and things. It was about trying to get her breathing so that her whole system was working better. So that kind of physiotherapy, and no, that wasn't available on the NHS. From when she was, gosh, I'm trying to think at what age, I think it was well over a year ago, she was ditched by physiotherapy because I think it was when she hit 16. She then fell in the cracks and hasn't seen physiotherapy again in the NHS because she's on the list for adult and they've not seen her.
In September 2022, your daughter was then formally diagnosed with POTS by a physician in private practice. But again, your GP refused to accept that and to follow the diagnosing physician's recommendations. Yes. Again, was the basis of refusal simply that the diagnosing physician worked in the private sector?
Yes, absolutely. Even though the diagnosing clinician was somebody who actually works in the NHS or worked in the NHS at the time themselves, But no, it's still, they still just keep saying they'll tell you what you want to hear. We don't believe for private doctors.
And you then since then have had to pay privately for the medication that's necessary to treat the condition?
Did until around, I think it was around September last year. We, through connections on Facebook, somebody had said that they'd speak to a doctor in a hospital in another area.
Yes.
Sorry, I'm trying to not say names, in another area to see if they would see my daughter, who was the only specialist that we were aware of in Scotland that treated POTS.
Yes.
And we were really lucky they agreed to see her. So because it was NHS, the GP agreed to do the referral, and she was then assessed by them, and they agreed with the diagnosis. You're thinking, well, actually, we've been telling you this. We're now on our third expert telling you, but now that they're in the NHS, finally you're believers. He prescribed the same medication that the private doctor had given her that the GP refused to prescribe, and he continued her on that.
Yeah.
However, I know that doctor, we've just had a letter to say that doctor is now no longer running clinics. So the GP's told us that we'll have to go privately again.
Yeah.
Even though she's been in the NHS now getting treatment, she will no longer be able to get it.
Yes. And that's in your statement, you mentioned that the specialist you had been seeing is no longer dealing with out-of-area patients. And it seems somewhat strange that a treatment that the NHS has deemed necessary and appropriate, and the GP has accepted as being necessary and appropriate, is now being stopped because the geographical extent of the specialist service has stopped.
Absolutely.
And is that the sole reason the GP has given for stopping a treatment that was presumably working and not causing any adverse side effects?
Absolutely. And not even not causing adverse side effects. This particular medication is the difference between her being able to walk around sometimes. She's, since being on this medication, she's been occasionally able to meet up with a friend, only maybe once a month for a couple of hours. But that's huge. That's a massive difference for her. Being able to sort of sit up all day and not feel dizzy and sick all day. POTS is extremely debilitating, and the medication was working pretty much well for her. She needs some tweaks still on it, but now she's going to be withdrawn from it because the GP won't prescribe it, or we pay privately, which obviously we'll do, but then what does everyone else do?
Yes, and you're not paying insignificant sums of money each month to have this.
Yeah, I mean that's it. It's I think it's about £275 for the doctor fee plus the medication, which I can't remember what the prescription costs were.
I think you mentioned £135.
Yeah. It was quite significant.
Yeah, thank you. And I think back in October 2022, your daughter had also developed gastric issues, and I think you had to go abroad again for that. And it was ultimately treated by proton pump inhibitors, which reduce stomach acid.
She was initially, but at least they took some course of action initially. She was at least had access to testing to rule out the things that would be normally the first things you would think about. But she still continued to have the issues, and even when we got back to the UK, so we've actually paid for her to be under another private doctor in the UK who is dealing with long COVID, but it's different to the first one who's dealing with the POTS, but she does deal more with the sort of the gastric side of things, and she's done extensive testing, and she's actually made a massive difference. But again, the GP had nothing to offer, and really wasn't very interested at all. To the point where at one appointment I made, they said, I've only got a couple of minutes because I've got patients to see. And you think, well, what are we? We're patients too.
Yes.
And it was like my daughter didn't matter, and that whatever we were coming to them with wasn't significant.
Thank you. And in paragraph 54, you state that your GP said he couldn't help your daughter as there wasn't a diagnostic tool for long COVID. And you say that you feel the NHS and Scottish Government wish to absolve all responsibility for patients with long COVID. And is it correct that in your experience, it's not just that they have been unwilling to assess long COVID, it's that there's been an unwillingness to treat individual symptoms, even as individual symptoms separate to being part of a collective called long COVID?
No, absolutely. There's so many things that they could do that actually benefit. I'm not necessarily saying they're going to be able to cure it, and I understand that. But there's things like the POTS, things like my daughter was anemic and was left anemic for over 2 years. We ended up having to get iron infusions overseas to actually improve her health, and again, made a massive difference.
Yes.
It's the things that they could do to help them feel better that they're not doing, and they're not acknowledging. As soon as you say, put it under the label of long COVID, it's almost like, oh, well, it's long COVID. I don't know anything about that. And the amount of doctors that have just said, oh, well, we don't know anything about long COVID. We don't understand long COVID. And that's what they've done. I mean, my daughter is now they've actually finally opened a long COVID clinic in our local hospital. But the doctor openly admitted he knew nothing about long COVID when we turned up for the first appointment. And I thought, well, I know so much more than you. How can you not know after 4 years about long COVID? How can that be the position we're in? How can the hospital have appointed somebody? How can there not be one doctor in that hospital who has said, this is interesting, I'm going to read everything about long COVID because this is progressing and there's a lot going on with it. How can there not have been one doctor in that hospital that understood long COVID to put in position and to put into the long COVID clinic? Nobody is interested in it.
Thank you. And your daughter's long COVID symptoms remain to this day and are continuing to affect her everyday life?
Yeah.
Is that correct?
Absolutely. She still can't study. She's trying to study little bits here and there, but she did a little bit the other day. She did an hour, but she hadn't done any for the previous 2 months. She's desperate to have a normal life. Just before Christmas, she went shopping with her friend. A friend took her in her wheelchair shopping, and it's the first time my teenage daughter has been shopping with a friend. You know, she was nearly 18 years old and she's never been shopping with a friend. It's normal life. She hasn't got a normal life, and she doesn't understand how people interact. She doesn't have anything like that. She spends most of her time with her mum. Like I say, she's just 18 now. What child of any age wants to spend 24/7 with their mum?
Yes.
And no one else? It's heartbreaking.
Yes. And what's been the impact of all of this on you and your family unit?
Well, for us, my husband's had to continue working overseas and separately from us, because otherwise we can't afford to pay for the private healthcare or have the private access to private healthcare over there. But predominantly to pay for the private healthcare here, because if he didn't, then we wouldn't have that. We would literally have nothing. We'd be nowhere with it. So I've hardly seen my husband for the last 4 years. My daughter's hardly seen her dad for the last 4 years.
Would your husband have moved back
Yes.
were it not for this
Absolutely. We had no intention of this going on like this. It's obviously sort of COVID hit and we were separated because of that, and that's understandable, and it happened to a lot of people. But for us, COVID's been 4 years because we can't go back to being together. My daughter can't travel as often as we'd like for her to go over and see him. It's a huge effort if we do travel. because we have to plan it, we have to arrange for her to be able to sleep before and rest after, and it has a huge impact. It's not as simple as jumping on a plane and going and getting some treatment or anything like that. It's really, really hard, and to not see my husband for that period of time, it's really, you know, difficult.
Yes, thank you. Now, we have your written statement, and we'll consider that in its entirety alongside your oral evidence today. Is there anything we haven't covered which you would like to highlight or mention at this point?
Yeah, I think one of the things that I think I didn't include in my statement that I was thinking about was, I think this now is maybe trying to understand going forward how they're going to fill that gap between with educationally. You know, my daughter is now 18. How does she now do her Scottish Highers? You know, there's going to be a cost implication for her. How would she couldn't even travel. Even if she was well enough to start studying, it's 20 miles to the nearest college because she couldn't go to a local high school now. Yes. She can't catch up. How is she meant to catch up? How are the children who have been out of education for 4 years, 3 years, 2 years, even 1 year, of any age, how are they going to catch up? Where is that provision going to come from? And, you know, I think things like that need to be put into planning and thought about going forward for the future, for this generation of children affected by COVID. And potentially, if something like this ever happened again, how are you going to fill that gap? Because she's now going to fall through the cracks, or we're going to have to pay for her to do the education privately again.
Yes. Yes, thank you.
Okay.
Yes, thank you very much indeed, Ms. Jelley. I'm very grateful for your evidence. That's all then for today. Tomorrow morning at 9:45.
Thank you, my lord.